stopped at this. We stopped at varicose veins, structure of artery, structure of capillary. So now we look at the physiology part, capillary exchange, and then the last part is control of blood pressure. Okay, two very important topics. Now, you know that the capillary, so let's look at how a capillary looks like. It is, you have the basement membrane, and the inner lining is just a single layer of flat cells, simple squamous epithelium. With lots of microscopic pores. Okay, there are lots of microscopic holes through which substances can pass. Okay, so you're going to see that in the capillary. So this is called the endothelium. This is the endothelium. So the purpose of capillary is exchange. Okay, so what is it that gets exchanged? All the nutrients, gases, okay, and so electrolytes, all of this gets exchanged between the blood and the tissues. So capillaries are called exchange vessels. Exchange vessels. Now, the process of movement will be simple diffusion or facilitated diffusion through channels. Okay, so all of the transport mechanisms that you have studied come under this. Okay. Now, the only thing that cannot escape out of the capillary is, so this is blood flowing through, nutrients and gases get exchanged. What cannot go out of the blood are the plasma proteins, that is the albumin, the globulin, the fibrinogen. Any large protein cannot escape, and blood cells. So these holes are not big enough to allow red blood cells, white blood cells. White blood cells can squeeze through sometimes, but generally they don't move out. Blood cells don't move out. Okay? So the process by which exchange occurs. So these are, let's just representatively draw some cells here. These are the tissues. Okay? So as blood enters the capillary, so this is the capillary, as blood enters, it is going to enter from the arteriole. It's going to enter from the arteriole end. Arteriole breaks up into capillaries. And then blood flows through the capillary, and then blood exits and goes into the venule. So this is the end of the oxygenated portion of the circulation. It will get into the venule and then it will go back to the heart, venule end. Now there are, whenever you talk about exchange, so something has to go out, you know, the nutrients, the oxygen, the carbon dioxide has to go out. So whenever things have to move from one compartment to another place, there needs to be a force. There needs to be a pressure that pushes it out or pulls it back in. Okay? So when you look at the level of the capillary, at the level of the capillary, there are two important forces. That allow fluid to move out of the capillary and to enter back into the capillary. There are two important forces. Why do I say move out of the capillary and enter back? Remember, when blood enters the capillary, oxygen that is there in the oxygenated blood, oxygen has to go out. And this oxygen has to enter the cells. Nutrients. The cells require nutrients. All the nutrients that are dissolved in the blood have to go out, and then it will enter the cells. Hormones. You have learnt about hormones. Hormones are transported in blood. They have to move out. Okay. And then as blood is leaving the capillary, what is it that needs to come back into the blood? All the waste products. So the cell makes carbon dioxide. So this carbon dioxide has to come out and it has to enter the blood, because then it will be taken to the lungs and thrown out. Waste products. The cell produces waste products, urea, uric acid, all kinds of waste products. These waste products also have to be brought back into the blood so that it can be taken to the kidney and thrown out of the body. Okay? So this is what I mean by fluid moving out of the capillary and fluid moving back into the capillary. Okay? Now this side, the arterial end, when things move out of the capillary, this is called filtration. This process is called filtration. So obviously only the oxygen, only the nutrients cannot go out. Water washes along with it. So the water that is there in the plasma will carry all these substances out. Okay, plasma is 92% water. So water washes these substances out of the capillary and then they get into the cell. And the same thing happens when things have to be brought back into the capillary. This water that has gone out will be pulled back into the capillaries, because you can't afford to lose the water from plasma. The water that has pushed the substances out has to be brought back in. So in order to push these substances out of the capillary and to pull the waste products back into the capillary, there are two important forces. Okay? The first force favors filtration. Okay? It favors filtration. That is, it allows filtration to occur at the arteriolar end. This is what is called the capillary hydrostatic pressure. Hydrostatic pressure is just any pressure exerted by a liquid. Because the blood is inside the capillary, we call this the capillary hydrostatic pressure. Okay? Now, what is this capillary hydrostatic pressure? It is nothing but the blood pressure. It is nothing but the blood pressure. As blood enters the capillary, what is the pressure of blood? That's it. Capillary hydrostatic pressure. And you know, blood pressure, I told you last time, when the heart pumps the blood into the aorta, the pressure is the highest. As blood flows further away from the heart, when it comes to the arterioles, pressure drops. And then when it comes to the capillary level, the pressure is only about 30 or 35 millimeters of mercury. So that pressure is called the capillary hydrostatic pressure. It is nothing but the pressure of blood as it enters the capillary. How much is this? This is roughly 35 millimeters of mercury. Okay? Now this 35 millimeters of mercury is the one that pushes the water out along with the oxygen and the nutrients. Without this pressure, things won't move out. So this pressure is needed to push the water along with the oxygen and the nutrients out of the capillary and into the tissues. Okay? Now, as blood flows from this end to this end, the hydrostatic pressure is 35 millimeters of mercury here. As it goes towards the veins, I told you what is going to happen. Venous pressure drops even further. Okay, the pressure starts dropping in the veins as it goes back to the heart. So as blood flows from one end of the capillary to the venule end of the capillary, the pressure drops to 15 millimeters of mercury. Okay, so the hydrostatic pressure drops to 15 millimeters of mercury. Okay, so that is one. So capillary hydrostatic pressure is the one that pushes the liquid out. Obviously, whenever there is liquid flowing through a tube, there is another pressure that is trying to pull the water back inside. Okay, see the plasma proteins. If you remember albumin, what is the pressure that albumin exerts? Plasma colloid osmotic pressure. So it pulls the water back into the blood vessels. Okay, so the plasma colloid osmotic pressure, which is exerted by plasma proteins, always remains the same because plasma proteins are not going anywhere. They don't escape. So this pressure exerted by plasma proteins is about 25 millimeters of mercury. Textbooks will differ a little bit about the pressures based on what research they have used, which research article they have used. But generally it is around 25 millimeters of mercury. Okay? So if you look at this, so what is the pressure that pushes the liquid out? That is capillary hydrostatic pressure. The pressure that pulls the liquid in, the pressure that pulls fluid in is the plasma colloid plasma protein colloid osmotic pressure. So just so that you remember, it is because of the proteins. Plasma protein colloid osmotic pressure, which is 25 millimeters of mercury. Okay, so just for ease purposes, we just use this. So when you take a look at this end, I'll come to your question. When you come to this end, 35 millimeters of mercury is the capillary hydrostatic pressure, which is trying to push the fluid out. The plasma proteins which are in the blood are trying to pull the liquid back in, but the pressure is 25. So which one is more stronger? The capillary hydrostatic pressure. So at the arterial end, because this is higher, okay, by about 10 millimeters of mercury, filtration occurs. Things get pushed out. But as blood flows towards the venule and it's going to leave the capillary, what is happening to hydrostatic pressure? It's becoming 15. Osmotic pressure is still 25. So which one is stronger now? The plasma protein colloid osmotic pressure is stronger, so it pulls the liquid back into the blood vessel. So this is what happens. Even as we speak, this is happening in all the capillaries of your body. All the capillaries. The millions of capillaries that are there supplying your tissues, this is happening all the time, okay, without fail. As blood enters the capillary, things move out because the hydrostatic pressure is stronger. It pushes the liquid out. On the venule end, because the plasma protein colloid osmotic pressure is stronger, it pulls the fluid back into the blood vessel. But when it pulls it back, it also drags the carbon dioxide and the other waste products which have to be thrown out of the body. Okay? So this is a simplified version of capillary dynamics. The more detailed version is because there is some liquid here as well in between the cells. So there is a little bit of pressure exerted by the liquid there, but that is minimal. Okay? And at this stage, you don't have to know that, as long as you know that the two pressures that determine how fluid moves from the blood into the tissues or back into the blood are these two pressures. Okay? And the plasma protein colloid osmotic pressure, the most important protein that exerts it is albumin. The protein albumin, simply because it's there in large amounts. Okay? So take a look here. So this is your hydrostatic pressure, which is pushing the water out of the capillary when blood enters. As blood leaves the capillary, this osmotic pressure is the one that is pulling the water back into the blood vessel as it leaves, okay, along with the waste products. So the summary is this. As blood enters the capillary, hydrostatic pressure is stronger. So water along with the dissolved nutrients and oxygen moves out. And as blood flows from one end to the other end, the hydrostatic pressure drops, the osmotic pressure is now more stronger. So it pulls the water back into the blood vessels along with the carbon dioxide and the waste products, which then get thrown out of the body. Okay? So this is the thing. Yes. So now this is called filtration, this end. What happens here at the venule end, where the water along with the waste products is taken up, this is called reabsorption. Reabsorption. So look at the word reabsorption. It is not absorption, it is reabsorption. Why? Because the water that was originally in the blood has gone out and you are pulling the same water back in. That's why it's called reabsorption. Okay? Not absorption. Just reabsorption. When we do digestive system, I will tell you, glucose is absorbed because it comes from your food the first time. So it's called absorbed. This is reabsorption. Whatever was there in the blood went out and then you're bringing it back into the blood. Okay, so filtration and reabsorption are the two mechanisms that help with capillary exchange. Okay, so two pressures, hydrostatic pressure and oncotic pressure. And do not forget these pressures, because when we do kidney, we are going to get back to them again. So wherever there is a capillary, wherever there is a blood vessel, if things are moving, these two pressures are important. Okay, these two pressures are important whenever you talk about movement of fluid. Okay, so out of the water, let's say 100% of the water escapes, almost 90 to 95% of the water will get reabsorbed. Okay? You don't want the water to remain in the tissue spaces because otherwise it will cause swelling of the tissues. It will cause edema. So you don't want this water needs to be taken back in. So almost 90 to 95% of the water that goes out at this end gets reabsorbed. So there is a little bit still remaining here, right? 90 to 95, so about 5 to 10% of water is still there. 5 to 10% of water in the tissue spaces. You cannot let it stay there. Otherwise it will cause issues, it will cause edema. So this 5 to 10% of that remaining water in the tissue spaces is taken back through another system of vessels called the lymphatic vessels. So lymphatic vessels, these are tiny vessels that are found in the tissues, and they return this extra water back into the veins. Lymphatic vessels return the 5 to 10% of water from the tissue spaces back into the veins, venous circulation. It goes back into the veins. Okay? Because you don't want that 5 to 10% to stick around in the tissue spaces, otherwise it would cause edema. Okay? It will cause swelling of the tissues. So let's see. And we did talk about edema when we were talking about the heart as well. How do you define edema? Edema is abnormal accumulation of water or fluid, more correct would be fluid, because it's not pure water, it is water mixed with salts. So abnormal accumulation of fluid in the tissue spaces, or tissue space is also known as interstitial space. Interstitial space. So what is all of this is interstitial space, what you see here, between the cells. Okay, abnormal accumulation of fluid in the tissue spaces. So when can edema occur? When can there be abnormal fluid collection in the tissue spaces? Think about it. If this pressure were to increase, normally it is 35. If the pressure is, let's say, 50 or 55, what will happen? Will water exit more? Right? So capillary hydrostatic pressure, when the hydrostatic pressure starts to go up, fluid will filter out even more and it will accumulate within the tissue spaces. So one reason for edema would be increase in capillary hydrostatic pressure, which generally happens when the heart is not doing its job properly, heart failure. Okay? Think about this second force. If someone does not have enough proteins in the plasma, hypoproteinemia, what do you think will happen? Less proteins in plasma. Less reabsorption, very good, less reabsorption. So there will be more accumulation of fluid in the tissue spaces. So hypoproteinemia is another cause. Hypoproteinemia, what will this do? It will decrease the plasma colloid osmotic pressure. So more fluid will accumulate in the tissue spaces. What will happen if the capillary itself gets damaged? Leaky, okay? Fluid will leak out. As if this capillary were to get damaged, fluid will start leaking out. So what is the commonest condition where capillaries can be completely damaged? Sepsis, burns, okay, very common burns. The moment there is a 2nd degree burn or a 3rd degree burn, even if you touch a hot object, and what happens immediately in that space? You see a blister filled with liquid, right? That's because the capillaries in the fingertip have been damaged. So fluid leaks out. Okay, and imagine that over a bigger surface area, it's going to cause a lot of fluid to leak out. So capillary damage is the third reason for edema. Capillary damage, as in burns.
Ketoacidosis would cause this too, wouldn't it?
Ketoacidosis?
Yeah, it would, that could damage the...
Now, one last thing. So, we have looked at all the things that can cause edema. Increase in capillary hydrostatic pressure, decrease in plasma colloid osmotic pressure, damage to the capillaries itself. Another important thing is this. The lymphatic vessels, which are returning the small amount of fluid back to the veins, if these get blocked, blockage of lymphatic vessels. Okay. The fourth cause for edema would be blockage of lymphatic vessels. So slowly things might accumulate. Okay, blockage of lymphatic vessels or surgical removal. Surgical removal of lymphatic vessels. This is another reason for edema. Okay. So we do see this in certain infections, parasitic infections. Okay. I don't know how many of you, it's probably not so common nowadays, but you know, slowly this 5 to 10% of liquid will not be able to go back into the circulation, so it will start accumulating in the tissue spaces, and over a period of time, the entire region will start swelling up. And because it's seen more, because it happens first in the legs, so the leg resembles that of an elephant. So that's why it's called elephantiasis. Okay, so you see this?
Also mosquito transmitted.
This one?
Yeah, filarial worms, they can be transmitted by mosquitoes.
Mosquitoes, are you sure? I don't think filarial worms, I don't think it's mosquito vector transmission.
It is.
I'll have to.
I had to go over this a bunch with Dr. Tupper for zoology. We did a whole unit on these guys.
Okay, let me check. I thought it was more filarial worm. I don't think it's mosquito borne. But you see, this is the leg. Hand, it can affect any place. And this is actually the scrotum. So it can even affect any part of the body. And this is a classical, I don't even know how, this is one of our very old surgical textbooks, like a, you know, like a cornerstone for surgery, Bailey and Love, written by, you know, 2 English surgeons. So we, like undergrads, we always follow that. Okay, so that's a picture. I don't know from where they got that picture, but it must be very ancient. Okay, so that is about another reason. So there are some parasitic infections that can also cause this. Okay, what we talked about. Okay, so that's the thing. So now we move on to the last part, which is the blood pressure. Okay, we have already talked about blood pressure. You know what it is, the definition. Pressure exerted by blood. Whenever we talk about blood pressure, we always refer to arterial blood pressure, not venous blood pressure, okay? Arterial blood pressure. So, as the left ventricle pumps the blood into the aorta expands, producing the systolic blood pressure. Once the ventricle relaxes and the semilunar valve closes, the aorta recoils and again presses on the blood that has been ejected into the aorta, and this produces the diastolic pressure. So systolic pressure is the maximum pressure, diastolic is the minimum pressure, and this is the normal. Okay. Now the anything above 140/90 or equal to 140/90 is high blood pressure. Okay. Now, when we say mean arterial pressure, I have just added the systolic and the diastolic and put it as divided by 200 millimeters of mercury. But there is a specific formula for calculating mean arterial blood pressure. Mean arterial pressure is diastolic blood pressure plus 1/3 of systolic blood pressure minus diastolic blood pressure. This is the formula for actual blood pressure. Okay, not that you have to know the formula, but I'm just trying to tell you what is the actual formula. So if you were to calculate based on this, systolic minus diastolic is 120 minus 80, that is 40. Okay, so if you look at the mean arterial pressure based on the formula, it is somewhere around 93.33 millimeters of mercury. Okay, not 100, not 100. 100 is the arithmetic average, but the actual mean arterial pressure is around 93. Okay. Now, blood pressure, does it remain the same all the time? No. There is a daily rhythm, which is called the circadian rhythm. So, when you are sleeping, blood pressure is at its lowest. When you are active, blood pressure is at its highest. Okay? So, depending on what time of what period of the day a person works, their blood pressure will change. So, in a night shift worker, if you are doing night shift as a nurse, your blood pressure will be high at that time and it will be low during the day when you are resting. Okay? So, this is a pattern which everything in the body follows. Hormone secretion, blood pressure, breathing rate, heart rate, you name it, all of them follow this kind of a rhythm. Okay? Blood pressure is definitely higher in males simply because of the body size, muscle mass. It's higher in males than in females. It has been found to differ among different races. Asians generally tend to have lower blood pressures versus Caucasians. Okay. Age, definitely. As age advances, if you see an 80-year-old with a blood pressure of 140/90, you would probably not treat it as high blood pressure. Because as age advances, your arteries become hard and firm. Okay. So, a lot of hardening and scarring occurs, so they are not as elastic as a younger artery. So, that is called atherosclerosis, hardening of the blood vessels. So, if you have a very elderly grandparent, maybe 80, 90, sometimes you can even feel their radial artery because it becomes hard with age and deposition of fat and all that. Okay. So, lots of things that alter your blood pressure. So, this is a graph that shows you with age, blood pressure rises. Okay. This shows you the blood pressure in males and females. So, I have already mentioned this to you. I don't know whether you remember. In males, during the younger years, up to about the age of 50 or so, males tend to have higher systolic, higher diastolic, the black. Females tend to have lower. But after the age of 50 or 55, both males and females, systolic also goes up, diastolic also goes up. This is because of, what is it due to? Menopause. So, lack of estrogen. So, estrogen is protective to the heart in females up to the age of 50, 55. Very protective. What does estrogen do?
Does it protect males at all in younger years?
No, because males do not have that much of estrogen. Females produce a lot more estrogen. And testosterone is not protective to the heart. Okay, so estrogen has two effects. Okay. Protective to the heart and also keeps the blood vessels dilated, vasodilation. You know that if the blood vessels are constricted, the heart has to work harder to push blood through a narrow vessel. Estrogen works to keep the blood vessels nice and open. Third thing, estrogen helps to decrease LDL cholesterol levels. LDL is your bad cholesterol, low density lipoprotein cholesterol. Okay, so up to the age of 50 or 55, women are protected. So rarely you will hear about a woman having a heart attack before the age of 50. Rarely. Whereas in men, it is quite possible. You will hear about men at the age of 40 going to the ER with a heart attack. In women, very rare. After menopause, the risk of heart attacks increases in women as well. Why? Because of the lack of estrogen. Okay? So estrogen is protective to the heart, it keeps the blood vessels dilated, reduces LDL cholesterol levels. Now this is just a picture to show you how the blood vessel, how cholesterol gets deposited in the blood vessels, especially in the underneath the tunica intima, underneath the endothelial layer. Fat gets deposited and then keeps getting deposited, and then there is fibrous scar tissue that forms, and this can cause narrowing of the blood vessel as well. Okay, so if you don't, and sometimes it can burst and it can sort of cause clots to form. So if you don't watch your diet, too much of fast food and all this pre-made food, those are all not good. Okay, so this will be there in everybody. Okay, some amount of fatty deposition is going to be there in everybody. There are papers that show that fat deposition begins as early as age 9. Okay, it starts from that age. So exercise and watching your lifestyle and your diet will help to delay some of these things. Okay? Now, blood pressure also changes with your position. So if you're going to take a blood pressure in a standing individual, it's going to be high. Okay? Why? Because gravity is acting on it. And then sitting, it will be lower. Lying down is the least. So lying down least, and then when you sit up, it will go up a little bit. When you stand, it will increase further. Emotional states will always end up increasing your blood pressure. Okay, why? Because, sympathetic nervous system increases your heart rate, cardiac output, so blood pressure will increase. Exercise tends to increase blood pressure a little bit, slightly. Severe exercise can decrease. Okay, hormones can do that. Diseases, there are lots of diseases that are going to raise blood pressure, but majority of the time, when somebody has high blood pressure, we don't have a reason for that. So we call it essential hypertension. Most of the time, there is no specific reason. Okay, so it's called essential. So genetics is involved there. Okay, it's mostly genetics. Now, let's see what is the next. Let me remind you about a few things, few of the equations that we talked about. And then we will look at this. Okay, so cardiac output. This is the first thing that we learned about. Cardiac output is equal to what? Stroke volume times heart rate. So don't forget this equation. This is the first one. Okay. The second important equation in cardiovascular system is mean arterial pressure. Mean arterial pressure is dependent on the cardiac output times resistance. Times resistance. This is the second equation that you should remember. We're going to talk about this. Now, what drives the blood from the left side of the heart back to the right side of the heart? The first thing is the pressure difference. Okay? Left ventricle generates a high pressure of about 93 millimeters of mercury average. The pressure in the right atrium is 0. So 93 minus 0, the difference is 93. This is the difference that pushes the blood from the left side of the heart back to the right side of the heart. So we looked at that, right? If you want fluid to flow from A to B, you know that pressure on this side must be high, on this side must be low, then only then the liquid will flow. Okay, so in order for blood to flow, you need to have a high pressure here and you need to have a low pressure here. So blood flow is dependent on the pressure difference. Yes, whatever works best for you to remember things. So or even if you don't know individual pressures, at least you should remember that the left ventricle, when it pumps the blood into the aorta, the pressure is, average pressure is 93. Okay, or 100. 100 is also fine if you just remember 100. And the pressure, why does blood flow all the way through the circulation and come back to the right atrium? Because the right atrial pressure is negligible, 0. So that's why it has to come back. So that's one. Okay. Second is resistance. What allows the blood to flow? What contributes to this is the resistance of the arterioles. You know, how, whether they are narrow or whether they are wide and open. Okay? So if it is narrow, the heart has to produce even more pressure in order to push the blood through those narrow blood vessels. If they are wide and open, then blood flows very easily. So this resistance mainly depends on the first thing, state of arterioles. The state of the arterioles, whether they are constricted, vasoconstriction, or vasodilation. Vasoconstriction or vasodilation. That's the most important thing. Okay? Always remember, vasoconstriction will increase the resistance to blood flow, will make it difficult for the blood to flow. Vasodilation will decrease resistance. It will make it easier for the blood to flow. So this is the most important factor in normal health. Okay, normal healthy conditions, the state of the arterioles will determine what your pressure is. Okay, whether the heart has to work harder or whether it is easier for the heart to pump the blood. Now the second thing, resistance. It depends on the length of the blood vessel. It depends on the length of the blood vessel as well. Okay. So here the first one, this is diameter, right? Vasoconstriction or dilation, this is the diameter, the space. This is the length of the blood vessel. So a shorter blood vessel versus a longer one. Shorter blood vessel, less resistance. Longer blood vessel, greater resistance. Okay. Now this is something which under normal healthy conditions we don't see much of a difference. The length of the blood vessel is not going to change, right? But the length of the blood vessel changes under certain specific conditions. For example, obesity. Obesity is one of the most important things. So the more the body starts accumulating fat, the more blood vessels have to form in order to supply those extra tissues. So the blood vessels become longer. So the resistance increases. And that's why obesity is a risk factor for high blood pressure. Because the heart has to work harder to push the blood through a longer blood vessel. This is the risk factor for hypertension. The third factor that affects resistance is also something that does not happen in normal health, but can happen under disease conditions. The third factor is viscosity of blood. Viscosity. What is viscosity? The thickness of blood. Okay. You know that blood is made up of cells and plasma. So the moment you have more number of cells, more blood cells, for example, polycythemia, increase red blood cells. What will happen to viscosity? Thickness? If you have more red blood cells, it will go up. Viscosity will increase. And once the blood becomes thicker, is it going to be easier for it to flow? It's going to be difficult. So increased viscosity will increase resistance. Opposite, in anemia, severe anemia, viscosity will decrease because there are less number of red blood cells and resistance will decrease. So there are three things that alter resistance. One is diameter of the arterioles. Second is the length of the blood vessel. And the third is the viscosity of blood, the thickness of blood. Out of these three, which is the one that is used for homeostatically adjusting your blood pressure? This one. Length of the blood vessel only when things change. Viscosity only in disease conditions. So remember, state of the arterioles, by constricting the arteriole, resistance will increase, so blood pressure will increase. If the arteriole is nice and dilated, blood flow is smooth, there is no resistance to blood flow, so the heart has to do less work, low blood pressure. Okay? So this is the most important thing, resistance. So what affects your mean arterial blood pressure on a day-to-day basis, on a second-to-second or minute-to-minute basis, is the amount of blood that is pumped by your left ventricle every minute, and what is the state of the blood vessels. These are the two things which will affect your blood pressure. So if your cardiac output increases, mean arterial pressure will increase. Okay? If the resistance increases, mean arterial pressure will increase. And vice versa. If cardiac output decreases, blood pressure will decrease. If resistance decreases, blood pressure will decrease as well. Okay? Yes, this is important, this equation and this one. Okay? With this in mind, now we are going to look at how the body controls blood pressure. Okay? So how can it control blood pressure? Either by changing the cardiac output or by changing the resistance. It can change your mean arterial blood pressure. So let's take a look at this. And this is the most important part of the whole thing. Your body regulate blood pressure. We have seen how blood pressure changes when you sit, when you stand, when you lie down, when you exercise. Blood pressure changes. But homeostatically, it has to come back to the normal. That is what in all systems are working towards. Okay? So, I told you about all this. Okay? So, blood pressure, if you look at it, there are two ways of controlling blood pressure. Okay? One is what is called short-term regulation of blood pressure. Short-term control of mean arterial pressure. The second mechanism is long-term control of mean arterial pressure. Short-term control means within seconds to minutes. Within seconds to minutes, the blood pressure will be brought back to normal. If it increases, it will come back to normal within a few minutes. If it decreases, it will be brought back to normal within a few seconds or minutes. This is a nervous mechanism. Nerves are involved here. The long-term control of blood pressure is controlling blood pressure over weeks or months, making sure that the blood pressure remains within the normal range over a longer period of time. Okay? This is a hormonal mechanism. This is a hormonal mechanism. Okay? So let's talk about short-term control. Short-term control. Okay? Within seconds or minutes. It is a neural mechanism. Nerves are involved. So obviously the highest level of control is your brain. So where exactly in the brain are the neurons that control your heart and your blood vessels? Where are they found? They are found in the brain stem. The medulla, specifically the medulla oblongata. So this group of neurons that you find in the medulla can be divided into two small subdivisions. One group of neurons specifically controls your heart. One group of neurons controls your blood vessels. Okay? So this is called the cardiac center. This is called the vasomotor center. Together, they are called cardiovascular center. Together. So they are all found in the medulla. So the highest level of control is here. Okay? So this is a very important, the medulla is a very important region of the brain. Neurons that control your heart are here. Neurons that control your respiration are here, breathing. Neurons that control your swallowing are here. So any severe injury to this part can cause instant death because it's going to cut off those neurons which control your heart, your blood vessels, your breathing, your swallowing. Very important region. And one of the oldest portions of the brain. Okay, oldest, all of this is new, evolved in humans, the cerebrum and all that. Cerebellum, pons, medulla are the older regions of the brain. Okay? So medulla is where you find the vasomotor center that controls the size of the arterioles, vasoconstriction, vasodilatation. The cardiac center neurons control the heart rate and the force of contraction of the heart, how forcefully it contracts. Okay? Now, for any reflex, so this is your highest level of control, but you need something to sense that blood pressure has changed. Okay? You need sensors. Where are these sensors located? The sensors are called baroreceptors. The sensors that detect changes in mean arterial pressure are called baroreceptors. Baro means stretch. The word baro means stretch. So these are basically stretch receptors. Just like you have muscle stretch receptors, these are baroreceptors. Where do you find them? There are two locations where you have these sensors. One in the arch of the aorta. Okay, they are in the wall. They are in the wall of the aorta. The other at the carotid artery, where the carotid artery goes up to supply, that is where you have another set of baroreceptors. What are these baroreceptors? They are just nerve endings. They are nerve endings, okay, which are in the wall of the blood vessel. Arch of aorta, aortic arch baroreceptors, carotid sinus baroreceptors. That is how you name them. So this is exactly in, if you look at the surface anatomy, this is how it will be. It will be right here. Okay, angle of the jaw, right here. Okay, is the carotid sinus baroreceptors. The aortic arch baroreceptors are behind the sternum, where the arch is. Okay, now these two baroreceptors, they carry the information to that cardiovascular center that I was talking about in the medulla through two nerves. Okay, so 9th cranial nerve and 10th cranial nerve. What is 9th? Do you remember? 9th cranial nerve? Glossopharyngeal, yes. Glossopharyngeal nerve and vagus, yes. 10th you won't forget because that's so important. Vagus nerve, okay? So that's how they carry the information, okay? So let's do this with just some examples, okay? Just try and understand this. You work it out. You will be able to work it out. Remember this equation, okay? Remember this equation. So let's take a scenario. Okay, let's say an individual is standing in attention for a long time. Okay, so standing still in attention. So what will happen to, gravity will be acting on the body, effect of gravity. On venous return. So what will happen to venous return in this individual for that brief period of time when they are standing? Standing still, no movement. What will happen to return of blood back to the heart? It will go down, okay? So venous return will decrease. If venous return decreases, what will happen to cardiac output? Will also decrease, okay? If cardiac output decreases, what will happen to mean arterial pressure? Will decrease, okay? So it will become less than the usual 93, okay? Now when the mean arterial pressure decreases, these baroreceptors are going to sense the decrease because they will not be stretched as usual, okay? So because of the reduction in blood pressure, reduction in mean arterial pressure, the baroreceptors are going to sense the decrease. So when I say baroreceptors, it includes both, okay? It includes both carotid sinus and aortic arch. Baroreceptors sense the decrease in mean arterial pressure. Okay. So this information gets relayed to the cardiovascular center. Information gets relayed to the cardiovascular center via cranial nerve 9 and cranial nerve 10. Okay, it goes to the cardiovascular center. Now, the cardiovascular center the job of the cardiovascular center is to increase the mean arterial pressure back to normal. That's the homeostatic mechanism. It's already decreased. It is less than 93 millimeters of mercury. So it has to bring it back to 93. So what will the cardiac center do to the heart rate and the force of contraction of the heart? What should it do in order to increase the mean arterial pressure? What should happen to heart rate? Heart rate has to go up. Cardiac center will increase the heart rate, and it will increase the force of contraction, which will then increase the stroke volume. So once heart rate and stroke volume increase, what will happen to cardiac output? Will increase. How can this be brought about? Which nerves are going to increase heart rate and increase stroke volume? Which nervous system does this? Sympathetic. Sympathetic. Sympathetic is the one that is going to increase heart rate and stroke volume. Now here on this side, the vasomotor center, which has also received the information, okay, this has to change the resistance. So if you want to increase the blood pressure, what should happen to the arterioles? Vasoconstriction. So vasomotor center is going to vasoconstrict of arterioles. Once arterioles vasoconstrict, resistance increases. Cardiac output has increased, resistance has increased, so mean arterial pressure increases back to normal. Okay. The opposite would happen if mean arterial pressure increases. Okay. Now, we're almost close to time, but this is something, if you're thinking that this is something, oh, I have to memorize this and I have to, this is all physiology. This happens every morning when you get up from bed. Every morning. Okay? You're in the lying down position. The moment you stand up, gravity acts on your body. And for a brief split second, all of this is happening. Okay? And even before you realize it, your arterial pressure that dropped a little bit is back to normal. Why? Because you're all young and your baroreceptors are hale and healthy and they are functioning. Compare this to your grandparents who is 80 years old or 90 years old. How do they get up from bed in the morning? Do they jump out of bed and start their activities? No. You know how they, very slow, right? They get up and then they are sitting for some time and then they slowly stand up and start their activities. Why? Because as age advances, baroreceptors become less and less sensitive. They also age. So that drop in blood pressure does not get corrected very quickly. So they have to sit for some time. When they change position, they have to sit for some time. Wait for the body to get back to the normal mean arterial pressure, then slowly stand up. So it all takes a while. Okay? So, and that's a very important thing. And sometimes even in younger individuals, the baroreceptor does not function too well. Okay? So you might have heard of this condition. This condition, postural orthostatic tachycardia syndrome. This is because the baroreceptors are not functioning too quickly. They are not doing their job properly. Okay? So tomorrow morning when you wake up from bed, this is the best way to revise this baroreceptor reflex. When you get up from bed, just think about what is happening. Okay? And it's not difficult at all. Not difficult at all. If you remember these two equations, when your mean arterial pressure drops due to any condition, your body is going to bring it back to normal by increasing the cardiac output and increasing the resistance. Okay? If your mean arterial pressure is very high, then your body is going to bring it down to normal by decreasing cardiac output and decreasing resistance. Okay? So that is the baroreceptor reflex, and here is the, this is from your textbook, the flow chart. I have written it out, this is with diagrams. But it's a very important reflex. Okay? Without this, we will not be able to function. Every time we change our position, we'll probably drop down because blood flow to the brain will decrease. Okay? So, and then long-term regulation, of course, is there. So we will do that. So today in the lab, we're going to start respiratory system, breathing, okay? Lungs. On Wednesday, I have asked one of my students who is doing his nursing program at Nova. He started last year. So he's coming to talk to you guys. So those of you who are interested in the nursing program, you know, be there, you can ask questions. Okay, you'll definitely get some information. Okay, so at the beginning, maybe about 15 minutes or so, 15, 20 minutes. Okay, so sometimes talking to somebody who is